Daniel was born with a congenital heart defect.
We found out about it while my wife was still pregnant with him during the ultrasound examination.
Daniel has a form of a condition that's called transposition of the great arteries. And transposition basically means that the arteries that come out of the heart are backwards.
Dr. Frazier decided that we needed to wait till he was about a month old to operate because he needed more heart tissue, because this was going to be a physically difficult surgery. Kind of like if you were going to sew something with cloth and you just didn't have enough cloth. So Dr. Frazier is telling me that, that this is going to be a bad, tough surgery.
You know, this is a problem that if you don't operate on and correct, it's not compatible with long-term survival.
Part of what Dr. Frazier had wanted was for Daniel to get sicker and for his heart to get more enlarged, and for him to go into heart failure. And then at the point where basically Daniel couldn't survive any longer was when Dr. Frazier was going to do the surgery.
It's just difficult when you find out that there's something wrong like that, you know. You start thinking of so many different things that can happen.
These arteries are really, really delicate. They're really small, and they have to be just perfect when you move them, or else the heart can't get blood. If the heart can't get blood, the heart can't beat, can't support the body. Not survivable.
A little while later, Paula came back and said, Dr. Frazier's not really even sure we can do the surgery that we initially planned to do.
His arrangement, his geometry was quite unusual. Out of our very large series, this would happen, what he had would happen in less than 1% of the patients. Again, it's not something that we haven't seen. We have seen it before, but it is unusual. And it is a much more difficult technical operation to get things reconstructed. So he had some nuanced problems of anatomy that made his operation challenging.
At this point, I started thinking, you know, well, what does that mean? Does that mean he's not fixable at all? Or does that mean we're going to end up on a transplant list? Does this mean that he's going to die? Then a few hours later, Paula came back and said, we tried to take Daniel off the bypass machine, which is the machine that supports his body while he's having the surgery done on his heart, and the heart isn't working, and it seems like the surgery that Dr. Frazier did didn't work, and she said, I've never seen this before, but he's going to undo everything, and he's going to try to do it over again. At that point, we just began to pray, and we knew that we were in the right place, though, that if it was going to be able to be done, it had to be done here.
Thank God it worked out great, you know, and I think it worked because of Dr. Frazier. You know, he kept going and made it work.
The whole time I was here, and things were very difficult for us. And we were surrounded by a lot of other babies with heart disease, and some of them weren't as fortunate as Daniel. That their defects were very complicated. Their defects were not fixable. That their defects required waiting months and months for heart transplants, and that for some of them there just wasn't a solution. And so the whole time I was here and I was thinking, oh God, why am I here and why is this happening to me? I kept thinking that realizing that I should just be thankful because there is a lot worse and that there is a lot more that has to be done. So I think the take home that I went away from all this was that you just have to keep having faith and you have to keep working at it, because if me or my husband had been born with the same heart defect as Daniel, we wouldn't have even had this surgery and we wouldn't have survived.
We derive enormous gratification from seeing a child who we know, who medicine knows, has a dismal prognosis, untreated, go to what we have every expectation of being a wonderful prognosis going forward.
He's a chunk of a baby. He wears almost 2-year-old clothes, and he's only 9 months. So he's thriving, he's happy, he's smiley, he's the happiest baby ever. He never cries, just a pleasure to be around.
I don't have words to thank them enough, you know, for what they've done for us and for Daniel. And, you know, they saved his life, and now he's alive because of them.